population of the United States is continuing to become increasingly diverse. 62.1% are white, non-Hispanic. 17.4% are Hispanic or Latino. 13.2% are Black or African American. 5.4% are Asian. 2.5% are of two or more races. 1.2% are American Indians and Alaska Natives. Along with this increased diversity comes differing religions and cultures and a wide range of beliefs about health, illness, and healing. It is not uncommon for a patient to refuse treatment when it does not align with his or her personal, cultural, or religious beliefs. Patients were granted this right to refuse treatment in a 1914 court case. Ethical issues arise when a patient refuses life-saving treatment that could benefit the general population, or when a patient has limited autonomy.
An event that exemplifies this ethical challenge and conflict occurred in 1990 in the case of Malette versus Shulman.
In this case, the patient, Mrs. Malette, was unconscious with life-threatening injuries. Dr. Shulman, the doctor on the case, decided that his patient needed a blood transfusion. However, Mrs. Malette was a Jehovah's Witness. Jehovah's Witnesses believe that blood is sacred and that it is not to be stored or used for transfusions. Therefore, Mrs. Malette's cultural and religious beliefs would not align with the doctor's treatment plan. The patient's medical card stating no blood was found. However, because she was unaccompanied by a family member and unconscious, the doctor made the executive decision to perform the blood transfusion, despite his patient's cultural and religious beliefs.
The patient was not respected as an individual with specific needs and wants. Instead, decisions were made based off the physician's discretion.
Although the physician did provide his patient with life-saving treatment, he did not consider the harm it may do to her emotional and mental well-being.
Although the patient had diminished autonomy due to the fact that they were unconscious, they're still entitled to an equal opinion on their medical care.
The patient's autonomy was limited. She could not voice her wishes or beliefs.
An issue of paternalism could also be addressed here at the physician level and physician authority. In Shulman's case, he wasn't in a position to compromise with his patient, so he should have abided by the legal document that his patient had. So how can we respectfully address situations where patients refuse treatment for cultural, religious, or personal reasons? So there are two possible ways to approach situations like these. The first is to understand that it's the patient's right to refuse any sort of treatment, and a doctor's personal beliefs should never get in the way of that. And the second is to consider all options and find ways to compromise. How can we avoid other situations like the Malette versus Shulman case? First and foremost, it's up to healthcare professionals to educate themselves in terms of culture. Cultural competence training may help improve how these situations are handled in healthcare settings. The only time one can draw the line in a situation where cultural or religious beliefs interfere with healthcare is when it puts other people at risk. Had Shulman had an understanding of the patient's culture beforehand, it may have brought an understanding to the gravity of the situation, possibly making him less likely to give the transfusion.
It is not uncommon for a patient to refuse treatment when it does not align with his or her personal, cultural, or religious beliefs.
It's important to remember, no matter how much you want to help or compromise, if the decision isn't harming anyone else, it's ultimately up to the patient.